All right, so welcome everyone. Thank you for coming. This is going to be the Senate meeting, February 15th. But first we're gonna have a presentation and a little Q&A session with Dr. Ralph Manchester, with Dean Matthew Burns, and with Associate Dean Anne Marie Alger, talking about COVID policies and some of the questions that were submitted ahead of time before the meeting. So with that, I will turn it over to President Justina Gorka to help ask some of those pre-submitted questions.
Yeah, thank you, Xander. Hi, guys. I'm just going to lay some quick groundwork. So these pre-submitted questions were through Facebook, Instagram, or Google Forms. I want to thank everybody here on call that helped advertise this meeting and make sure that we got as many questions pre-submitted early as we could. We prioritized a couple, and anything we don't get to today, we're going to submit and hopefully share through our social medias on FAQ so that every question gets answered. And you can also refer to this after the meeting today and tell your friends. Okay, so I'll be doing my best to direct these questions specifically to the administrators present. Welcome all. It's been a while since we've all been on a call together. The questions are going to be categorized into 8 just relative student life categories. So I'm just going to go in order of how they come. So, all right, without further ado, to keep the flow going, the first category is going to be residential life. And I think you guys can know where the first question's coming from. So there's a lot of students that are curious about the possibility of reviewing the guest policy this semester, and specifically potentially changing the policy so that it is like a 1 visitor, something similar to what we had in winter break, where it's like a 1v1. Students are kind of curious why we decided to shift back in the spring to no guest policy at all. And I was kind of hoping maybe Dr. Manchester, if you could elaborate a bit on the thought process of that.
Sure. When the more relaxed visitor policy was put in place for winter break, the intention at that point was for it to only last during winter break, and for it to be reviewed as we approach the beginning of the spring semester, but it would sort of be the burden of proof to show that that would be a safe thing to continue, rather than just assuming that it would continue. And the reason for that was that we anticipated larger numbers of cases, just because the spring semester has students arriving in January, whereas the fall semester had students arriving in August. And we expected there to be a lot more COVID in the winter than there was in the summer. And that, of course, turned out to be true. So there really was no active consideration of extending that more liberalized guest policy into the spring semester with much larger numbers of students on campus and larger numbers of COVID cases on campus.
Perfect. Okay. And I just want to remind everybody on call that if you have any follow-up questions or answers, just feel free to note that for the open Q&A. All right, moving on. I guess this is more for Dean Burns. This is kind of like a hypothetical that is a kind of like a moral dilemma for students in relation to the guest policy. So this particular student asked that, was curious that if they'll be punished for trying to help a student who is having a mental crisis or any other emergency in a room across from them. So like, essentially, can I, as a concerned student, go help somebody in a different family unit in a different room without getting punished by conduct in a way?
The short answer is, with just that bare detail, the answer would be no. But every case has to be looked at. So what you should do if someone is in crisis is get whatever help that person needs, or that person to the help. So if a person is experiencing a mental health crisis, your role as a fellow student would be to make sure that the proper people get to that student, or that student gets to the proper people. But your role would not be to spend the night with that person because the person is depressed or something like that. And the whole notion of getting in trouble, I mean, every case is going to be handled on its individual merits, right? And for most of the cases that are coming to our attention, they're reminders, they're warnings that students are given that don't rise to the level of your having to report that out at the end of your tenure here as a student. So there are some circumstances where if you get into trouble in conduct, you'll get sanctioned and you'll have to report that sanction out to a potential grad school, or that'll come up if someone is doing a background check on you. Almost all of the COVID violations that have come to our attention so far have resulted in those warnings. However, when we come across really blatant violations, just blatantly having parties without masks, or repeated violations, then you start to see the hammer drop pretty hard. And you'll see sanctions like deferred removal from residence coming out, which basically means for a period of time, if you get involved in any other violation, you're going to be kicked off campus. It could even rise to the level of deferred suspension or expulsion. And there's always removal from residence, suspension and expulsion as well. So all those things are on the table, but hardly anyone throughout this period of time has received a violation that resulted in a sanction more than a warning. So again, the short answer is no, but it always depends on the circumstances.
Kind of a quick follow-up to that. A student was curious if they were to be approached by contact tracers and, to be honest about what they were doing leading up to the positive case, would they face consequences for that honesty by conduct?
They wouldn't get in trouble by the conduct process. It's possible for a violation to come to our attention two different ways. So it would never be because of a contact tracing that a person goes through the conduct process, even though they might have to have a discussion about that, right? But if that comes to our attention through a COVID-19 report or a public safety report, that might be the way that it comes to our attention other than contact tracing. In that case, it would be a conduct violation.
And I appreciate the brisk responses. We have around 10-15 minutes left of the moderated Q&A. Thanks for sticking with us, guys. The next question is kind of specifically about quarantine. So I guess a couple people can answer this one. So without disclosing too much detail, a student was concerned about the protocol for quarantine when it comes to positive cases within a household suite situation. So is there any clarity we can get about what happens in the case that there is a positive within a suite or household?
So I can start. When we find out about a student who has a positive test, one of our contact tracing staff contacts the student and asks, who have you been within 6 feet of for 15 minutes in a row when at least one of you was not wearing a mask? So that's the definition of an exposure contact. And if there are people that infected student has been around under those circumstances, then they are identified as contacts and they will need to quarantine. And it doesn't really matter all that much whether that occurred in a suite or a double room or a lounge or a designated eating area or any place else. We just have to follow the Monroe County Department of Public Health definition of a contact, because that's the definition they're going to apply when they do their own contact tracing.
Perfect. Okay. I'm going to shift gears a bit and go to testing specifically. So hypothetically, I fill out Dr. Chat box. I'm experiencing some symptoms. What are my immediate next steps? Will I be reached out by UHS? And can you give a kind of a timeline? How long should I be expecting contact?
Your UV log, and that can be messy because then sometimes they'll be the next.
Apologies. Dr. Manchester?
Yeah, so anyone who reports symptoms on Dr. Chatbot will get a call from one of the UHS nurses. We try to get to those as soon as we can, but it depends on the volume of yes answers we get on any given day. And the nurse will ask more detailed questions about those symptoms and tell the student whether you need to come in to be tested today or not. And we have testing available at the UHS River Campus office. And in most cases with students, we will do both a rapid test and a PCR test. So we'll have the rapid test available within 15 minutes, and we'll know whether you need to go to, well, you'll need to go to quarantine if we do any kind of test, but at least you'll have some idea how likely it is that the PCR test, which is the most reliable, will be likely positive or likely negative. So that's how positive responses to Dr. Chatbot are handled.
And then kind of a follow-up, Dr. Manchester, on testing. There were some concerns on various social media platforms that a student couldn't acquire a test over the weekend if they're feeling symptomatic. Do you have any clarity on that? And if you cannot, have UHS distribute tests on the weekend, what are some alternatives that students can pursue to getting tested?
Sure. If the student is having symptoms, either we will test them on the weekend at UHS, or especially on some Sundays, we have not been able to identify staff to be working at the River Campus office. And in that case, we've arranged for transportation to take the student to urgent care and then to quarantine or isolation. You're
There we go. All right. I'm going to shift gears so that you're not too much on the hot seat right now, Dr. Manchester. Our advisor, Anne-Marie Algier, you're up. Okay. This is more about student life and mental wellness, so I'm hoping you can give us some answers. First question that a student submitted was, I guess, some low risk activities that students can do currently on campus to connect with one another.
Yeah. Hi, everybody. Good to see you all. And it's nice that you're doing this. And I want you to know that how quickly Dr. Manchester and Dean Burns came on to a Senate meeting being asked today. I hope you realize that you have a lot of caring people out there in the administration and throughout campus that are really trying our best to help you guys through this. So the more we can dialogue together and figure out how we do things safely, the better. But if you go to our Wilson Commons Student Activities webpage, we have a section called Connect to the Hive. It's a newer feature that we have, and it has a whole listing of resources for everything from how to join a club to a medallion program, resources on campus with events and things you can do, connecting to the chapel and the different walking paths they have, lots of different activities you do. So if you look through there, there's a whole list of resources that we've just recently added so that anyone, whether you're a single person or whether you're in an organization and want to do something with others, things that you can do at low risk.
Perfect. Thanks, Amy. Kind of related now, specific to mental health. I believe that ISAC, one of our International Student Affairs committees, has been trying to address this problem. But like recently, there's been a conversation about international students that are back home trying to seek out mental health and kind of the restrictions with that, legally speaking. What can a student do if they're not in the United States currently to get mental health counseling? Is there anything that UCC can do in particular to help those students?
That's a good question. Ralph, do you, Dr. Manchester, do you know the answer to that?
Yeah, the UCC staff are not legally permitted to actually do counseling when the student's in another country, but they could certainly provide advice. We've got some lists of resources in other states and other countries, and that we don't necessarily have something in every country in the world, but they may be able to at least point an overseas student in a direction to find someone more locally who could help them. And we also have the TAO program, Therapist Assisted Online, which I believe any student with web access should be able to interact with.
And Justina, I know that Alexander has scheduled Molly Morrison and Laura Ballou to come next week to talk about the different resources that the Karen Climate Committee has put together. And as part of that is all the new, like the UCC drop-ins, the telehealth, all those things, as well as other mental health resources and things for students. So that's definitely coming for next week. But if you need it sooner, we can make sure that we get that to you.
Perfect. Okay, we'll touch base. You actually answered my next question about other services that are available in UCC, so took one off the list. All right, moving on though. So federal support. This is a really specific question that we got on the Google Forms sheet, and it's on the latest federal COVID relief funding that was distributed back, I think, in December. There was a section on it for higher education with money, I believe, specifically to students with financial need.
Yep.
So, yep. Okay, I'm getting that right. Awesome. So I was wondering what the university plans to do with, our particular relief package. If we've already started distributing, how is that going to look? Some other universities in the area have already kind of outlined a plan. So I'm curious if U of R is doing something similar soon.
Yeah, it's actually on the website, on the financial aid website under the CARES Act, emergency grants for students. It's all, we have to report out how we're distributing those funds and how you do it. And they were a little bit more specific this time. If you remember the first time, there was, many of you might have received a check from the university from the first CARES Act, because that one was different. And so the university just distributed it widely, and pretty much everybody kind of just got the same thing. This one was more geared that the students who were more needy were supposed to get the funding, and the ones who really needed the financial assistance. So our financial aid office worked really closely following the guidelines, and you can see it on that section of the website.
Perfect. Okay. My internet might be going unstable, so just let me know if I start cutting out. Faces were freezing on my screen. But okay. Moving on, another section, communications. So, I'm sure we're all aware, especially student government people on the call, there's a lot of different outlets that administration likes to share updates to students, whether email, Rochester website, also social media platforms. This question is more specific to what are the main university resources that students should be paying attention to get the most frequent and encompassing updates about changes of guidance, whether it be like moving from yellow to orange zone, or if there's just like some internal university policy changes that we should really be on top of.
I think the COVID-19 website is probably the best catch-all place. When things happen urgently, it is normally the president or Dean Runner, most recently Dr. Manchester, that sends out messages that students have to receive most urgently. But the COVID-19 website is updated every day, and it's the place that's subject to the most criticism and critique. So they try to improve on the information the way it's displayed every day. So I think that remains the best source of information about all of this, including any policy changes. And if anything urgent happens, then just pay attention to your inbox. If you see an email from President Mangelsdorf or myself or Dean Runner or Dr. Manchester, that probably is an indication that we've got some important breaking news that we don't want to wait for you to just kind of log on to the website and take a look. I don't know if Anne-Marie or Dr. Manchester, you have anything to add to that?
That's where I would have sent it to. And I noticed in those questions there is the FAQ is on there as well. And there is also a contact. So if there is something that they don't see there, you can send a question in and someone will answer it.
Awesome. Okay, we have 2 questions left, 3 minutes left on the clock. No pressure. Okay, so this question is kind of just like in relation to the change in dining policy recently and overall confusion, I guess, on the application of New York State guidance from campus building to campus building. Students are curious why you could sit with a group of 4 in Feldman Ballroom in Hearst unmasked while you're eating, but not sit with a similar amount of people in the libraries. There's just, there's confusion on the application of guidance. So I guess Dr. Manchester, if you could help with that.
Sure. And this is one of the sort of themes that's come up since the beginning of the pandemic, that if it's safe to do something in one, or if it's permitted to do something in one scenario, then it must be equally safe and therefore permitted to do it in another scenario. And that's not the best way of thinking about risk in a pandemic. We want to minimize our individual risk over a 24-hour period. You can't really eat with a mask on. So your only two choices are to eat alone or eat with a small number of other people without a mask on. You are at some risk. And in fact, our contact tracing has shown that that is one of the more common ways that students become infected. They are following the rules. They are sitting at a table with no more than 4 other people eating just for the time that they're eating. But if one of the people at that table is infected, they are at risk, and some people get infected that way. We want to minimize the number of times that that happens. And therefore we say, when you don't have to have your mask off, keep it on. You can study in the library with a mask on. And that's the way to keep the risk down.
All right. And then a final question. Before that, I just want to remind everybody, if we don't get to your questions, feel free to honestly message us as well after the open Q&A. Thank you to all the administrators that can make it to the call today. Hopefully, get some clarity from this and can produce an FAQ to share with students promptly. But yeah, my time's running up. So the last question's pretty open-ended, but it's just relation to the pause. Students were curious if there was going to be any steps between, the increase in cases that we're seeing to a pause, if administration has been looking at potential other alternatives or future plans to sort of try to mitigate the risk and the spread more before we hit the pause.
Yes, and those are discussed 2 or 3 times a week on the CURT meetings, the Coronavirus University Restart Team, and the Emergency Operations Committee meetings. We want to avoid getting to the point where the state could tell us what we have to do. So we look at the numbers and discuss where are the infections occurring? Are there things that we can do to reduce those situations where infections occur? Fortunately, even though we were concerned last week and the week before, we only got about halfway to the point where New York State would come in and tell us what we have to do. So that's good. Because of the New York State rules, as of Saturday, we started a new 14-day reporting period. So the count went back to 0, and now it's starting to creep up again. And we'll be watching that and looking at the patterns of infection and seeing if there are any changes that we ought to make so that we don't get to the point where we're on pause.
All right, thank you very much for that. I think we can now move into the portion of the live discussion. So the way that I think is going to be easiest to do this, rather than doing Zoom hands, which can get hard to tell who raised their hand first, if you can just type your name in the chat if you have a question, then that'll make it easier. We can just go in order of the names in the chat. And then we can turn it over to Leah Tome. And just as a reminder, actually, sorry, before we begin, just as a reminder, everyone to please be respectful of privacy. If you're going to ask a question, be sure that it's not about a particular specific situation that happened or a particular person or group, and that you're respectful of the administrators that are on the call. Go ahead.
Hi, I actually just have a question related to testing. So there are several students that have heard from that they have been either in close contact with people that have tested positive or people that have been sent into quarantine or isolation, and they have been refused testing or their testing appointment was canceled once they signed up for that. So I'm just wondering, why are students not able to get tested if they feel like they should get tested? And will there be a change to that policy? Thank you.
So even though we have more resources for testing this semester than we did last semester, we still have a limit on those resources. Now the limit, frankly, is staff time to collect the swabs and run the tests and report the results. So if a student meets the definition of exposure that I mentioned a few questions ago, then we require the student to be tested. And then the other major part of our testing is our surveillance testing, and we're randomly selecting 400 students a day to be brought in for testing. We just don't have much more in the way of resources to do testing beyond that and test the students who actually do have symptoms. So if a student believes they might have been exposed, but they weren't identified through contact tracing, right now we don't have the capacity to test those students. There are other testing facilities available in the community that students can access if they decide to do that. Obviously, transportation there would be an issue. But we are functioning at or a little beyond our current staffing capacity right now.
All right. The next, I'm sorry, I don't know how to pronounce your name.
Hey, Arapul.
Yes, Arapul.
I just want to bring up some points that I've personally gathered around tone from the student body, and including myself. So as you guys mentioned before, the International Student Committee has already brought up a lot of questions and the concerns about the mental health of the student body. And as an international student myself, I can pretty personally relate to a lot of that, because personally I wasn't able to go back to see my family for the last almost 2 years now. Most of my human interactions happen with me and my closest friends and my significant other. And because of the pandemic, I understand it's nothing personal against me or other international students or just the student body in general, but the social isolation is very, very real. And I feel like the school has taken a really good care about preventing the physical health issues of the student body, but has been lacking a lot on the mental health department, especially on the social interaction part. I appreciate all the effort put in for the Discord, the Zoom, and everything like that, and the distance socializing, but it's just the fact that we cannot legally hang out with another person except for when they're eating. It's just absolutely detrimental to a lot of the close friendships and relationship we're having. And trust me when I say this, 90% of your friend group who used to be so happy around you and telling you that they're having mental issues, every single one of them, like 90% of them, including yourself, are feeling that weight that you cannot shake off. It is really serious. And I feel like maybe there's a way for the school to evaluate a responsible way for students to be able to hang out, like a extended family unit, and not something you can change every now and then to increase the spread, but just like a +1 or a +2 that people are able to hang out with their significant others or their best friends during the time of the crisis without having to go to parties or spreading around everywhere. And the fact that I've been trying to send out messages around to my fellow classmates about how they're not alone, but I feel like the school should also voice up in that and make sure that everyone is doing mentally okay, because I feel like the mental pandemic is also creeping up as the
I think Dr. Manchester probably weigh in on this, but Arapul, I hear you, right? I live alone as well, and I haven't been out of my house except to go to campus for a long time. And so even though I'm not a student on campus, I can only imagine how isolating that must be for you. because at least I'm in my own home, right? And not so close to other people where I'm dying to just go to the room next door. So I do understand where you're coming from. I think for his part and UHS, they've been doing their best to look at the state and the county guidelines and to make sure that the university is following those. To Anne Marie and Wilson Commons Student Activities staff, they have been bending over backwards and working overtime to bring as many activities, in-person activities. The problem with that, of course, is that we're so limited in the number of students that we can have in any particular activity that they have to program the same program over and over again to reach a portion of the college student population. I'm certainly open, and so is Kurt and the Emergency Operations Committee, to hearing ideas. But we, at the core of this, we have to keep looking at the guidelines and keep people safe, right? So every single day, it seems that Anne Marie and her staff are coming up with new ideas for programming to try to get you into safe places where you can socialize a little bit, even with your masks on. The ice skating rink is a good example of that, right? We've never had something like that before, but that in itself takes hours and hours and hours of prep every single day and a lot of money. Money is not going to be our primary issue. So if you've got ideas on things like that where we can get to some of those, I'm open to it. But I want you to know that people are trying their best to be extremely creative in bringing you ways to socialize, both in person and online. So I can only say I hear where you're coming from, and I'm going to remind you that CARE is still in place. If you have friends that would benefit from reaching out to them, we'll get in touch and we'll do our best to connect you. If they don't know what's going on, we'll make sure they know. If they don't know that where counseling is available, we'll try to get them to that. So I appreciate your comments and expressing how you feel, and thank you for that. And if you do have any ideas, let me know. But we really are all trying our best to get through this as best we can. And I know how difficult it is, especially after a year of doing things like this. So thanks.
Will be a way for letting you know if I have any ideas and structural changes that might help student bodies.
Matthew.burns@rochester.edu. It's open to all of you.
And if you have more ideas for programming, you can send them my way. Same, look at my last name, that's up there, .rochester.edu. Same thing. And we just bought some snowshoes. We had actually someone, a donor that gave us some funds. So I have some snowshoes, so you could rent them out together with your friends and do that, to hike through GVP or through campus. We're also going to be taking some things. We're looking at some snow tubing days. We're looking at some different, because we think being outdoors is a lot better than being indoors with the virus. So trying to find ways that you guys can connect. I know the class councils are working really hard. They're trying to connect you both as a class and with activities, and the seniors, they're planning some events that we've got coming up, and some happy hours in Hearst, and a trip off campus to Rohrbach's like we did in the fall. So please send ideas. We are trying. We have programs every weekend. Our card game nights are going really well, and you can bring, you can sit with your friends with your masks on in Douglas and play the cards, right? You can do that in the 4-person seats and things. So there are ways. It's just, it's difficult, as Matt says, but the resources also that they put together for the mental health about Mindfulness University too, is also we are so lucky to have that program that Amy McDonald and her team does. It's really amazing, the resources that you can have, and really it helps your mind space a lot. And you could do it, at the same time with your friends too, and put you all in a good headspace. It's a great resource that I don't know of a lot of other colleges that have that as in depth as we do.
All right, in the interest of time, I think we can probably go to the next question, and then we can circle back. And if there's more additional ideas that students have, we can also create a form at the end of this meeting to submit additional ideas. So I believe it was Senator Liang. Amanda, who was next?
Yes, thank you. I have 2 questions. The first one is a follow-up. Regarding the fact that we have a lot of money available for programming, is it still the case that staff members are still on furlough? Is central administration still on a pay cut? Is that still going on, or is that also no longer happening?
Furloughs are done to my knowledge, and there's no plan to have any in the future. I forgot the second part of your question, Amanda.
There are still salary reductions in place.
Oh, okay. Thanks, Rob.
Okay, my second question is more so about the recent rise in cases. I was wondering if you could tell us anything about them, including where are transmissions occurring, as well as, well, yeah, let's start with that. Where are transmissions occurring the most?
So in some cases, it's unclear where a student became infected, but when we can identify a source, they fall into two general categories. One is the student was following all the rules, and as I mentioned earlier, they just happened to have a meal at a table with another student who was contagious, and they became infected. The other general group is some students have done things that are clearly not permitted by the rules. Going to a residence hall where that student does not live and hanging out for several hours without masks on with people in that building. So that's obviously a concern. Beyond that, as I said, in some cases, student says, I have no idea where I got the infection, and we know that happens too. And the higher the sort of background rate of infection is in the community, the higher it's going to be on campus. Fortunately, that is decreasing in Rochester now, and we hope the numbers will be decreasing on campus in parallel with that. But it's still substantially higher than it was at the beginning of the fall semester.
So a follow-up to that, this came through our committee actually through some students, but there have been anecdotes about inequitable enforcement of policies where some students are being referred to conduct and getting adequately sanctioned as per the policy, and some students are not being referred to conduct at all, even though, say, an RA saw them or their peers saw them. I was wondering what your response is to this. I was wondering where you think that responsibility falls, because it seems like, one, not all the RAs are on the same page about it. Two, it's quite unclear to me how Res Life is properly implementing anything.
All right, well, let me try to get at some of that, Amanda. We follow up, the conduct office follows up the Center for Student Conflict Management based upon the reports we received. And that's the simplest answer I can give you. So if we don't receive a report, there's no follow-up. And so the inconsistent enforcement of, well, there are two parts to enforcement, right? One is telling people to put their mask back on, and the other thing is to make a report about it. So I think there is a lot of the former, and it might be the case that I need to look into the latter, because there should be consistency across the board, right? There's consistency in sanctioning once they get to the conduct office, but I think what you're identifying is a problem in their getting to the conduct office in the first place. And so there needs to be some sort of consistent enforcement of making sure that both things happen, that students are reminded to comply, and that if they're not in compliance, that they are reported. And I don't have a good and simple answer for you, because I'm not aware of everything that's happening throughout the residence halls or on campus and every single incident. But I certainly can have a conversation with Residential Life and ask them the same kind of questions you're asking me.
All right. Again, in the interest of time, I think it's probably good to keep moving through the list. But thank you for that. And we'll go to Ian Krager.
Hi, everyone. Ian Krager, I'm a junior here. So I want to begin just with two hopefully quick questions. One of them is a follow-up. So the first one is probably an IT issue, and so probably nobody has an answer to this, but I did want to kind of bring it to everybody's attention just in case there's something that can be done. Dr. Chatbot reminders keep going out if somebody has already filled out the Dr. Chatbot, and so I'm not sure if that's something. I'm sure you're aware of it, but just so that we can bring it up again in this forum. it's kind of annoying to have already filled out Dr. Chatbot and can continue to get reminders about it. So again, just want to put that out there. The second one is, oh, great. Thanks, Mark. So then second part is regarding the kind of a follow-up to one of the questions that Justina asked regarding the December COVID relief package that was signed into law by President Trump. And that had funds that were earmarked for the Higher Education Emergency Relief Fund. I did, and I thank you, Dean Algier, for directing us to the financial aid website. I really appreciate that. But I did go on there and I wasn't able to find any information about the second relief package. There is a ton of information there about the CARES Act funding, but there isn't any information about the second package that was passed in December. And I know that you mentioned that students would have to apply for emergency funding. And I'm just wondering if there is any more information about how that decision was made, because I know at other schools such as Temple University, it was announced just last week that any student that receives a Pell Grant will automatically receive funding, and then anybody beyond that would have to apply for emergency funding. So I'm just wondering, you know, how that decision was made to qualify who receives the funding or not. And if there is any information that will be announced from the university rather than having students look it up.
Yeah,
Question
I
after.
will have that follow up, that because that came from the financial aid office person for me, that's where it would be found, would be on that, under that CARES Act, talking about the second distribution. And they did bring that up in our EOC meeting a couple weeks ago, talking about that was getting dispersed according to what, you know, the government's pretty specific.
Sure.
And how they want that managed. And we have to be very specific in how we do it and very transparent. So that definitely will, if it's not up there yet, will be up there, but I will follow up, Ian, and make sure that we get that information to Justina and Alexander so they can, however they're going to do follow up questions. I'm assuming you're going to put them like in one place or something. We'll get that for you.
Thank you. I appreciate that. And then finally, if you
So, sorry, just in the interest of time, I think we should keep going down the list. If the administrators on the call are okay with it, maybe like 5 more minutes of the questions. And then if you want to just put your name in the chat again, if we have time to loop back, we can loop back to your question. Unless it's like super quick, like 30 seconds.
It is not quick.
Yeah, then if you can just put it in the chat, we'll come back again. We'll go to Grace.
Hi, I'm a senior, and I just have a question. I'm immunocompromised. I qualify for a vaccine as under the new recommendations of New York State. I registered for a vaccination appointment. I was able to get one in Utica in March. I have to drive to Utica. I have a car. I'm lucky enough to have a car. My roommate is driving their significant other 6 hours to Potsdam to get their vaccination. On the website and in the emails, there kind of is allusions to when the student body becomes eligible. There will be some sort of like clinic or driving or anything. And I'm just concerned because I would wager 10 to 15% of students, given the rates of asthma alone, are immunocompromised and qualified for the vaccine and will not be able to drive, as most Rochester sites are full, to my knowledge, to be able to get the vaccine. What will the university be doing to serve this portion of the student body? Because to my feeling of the situation, it doesn't feel like they're being treated as if the entire student body tomorrow, we were all allowed to get the vaccine, they would put a clinic on campus, for instance. What is the plan for the immunocompromised kids who can't drive themselves 4 hours to get a vaccine?
Yeah, the fundamental problem is vaccine supply. And until there are substantially larger numbers of doses available, this is the situation we're going to be in. Speaking quite frankly, I do not understand why they opened up eligibility to 3 million more people in New York State when they were already saying it was going to be the middle of April before they could finish vaccinating healthcare workers, get the other essential workers and everyone over 65. But, you know, I'm not in that level of decision making, so that's just my frank opinion.
Will they be releasing resources to students, like telling them of their eligibility at least? Because I really haven't seen anything covering it.
Yeah, we have not put out anything specifically to students with underlying medical conditions who, as of yesterday, qualified because we have no vaccine to give. The place to look for the most reliable information is the Finger Lakes Vaccine Hub website.
All right, we can go to Senator Tulloch. Andre.
Hello. I had two questions. The first being related to residential life. So the question is, when students are becoming, our students are being put in quarantine either due to exposure to infection or actually having an infection, RAs are not being able to find out if their residents are going into quarantine or have COVID. And I think this becomes more of a pertinent issue when we look at areas that have communal style bathrooms, study spaces, more lounging spaces. So I wanted to ask, why aren't RAs being told when their residents are going into quarantine for COVID related issues?
Well, it's at least in part a confidentiality issue. When the student has a medical diagnosis, that information can be released only with the student's permission. The student, of course, is free to tell their RA, hey, I'm being moved to isolation or quarantine, but we have not put in place a routine notification process from UHS really to anyone else other than the group that's involved in getting the student into the new housing.
Would it be an issue to have a system in which the RA would not know who exactly is going into quarantine, but we would be able to know that there's a person on their floor going into quarantine? Because I think that's an issue for everybody, in that, somebody in your close proximity is not knowing that you have, you don't know that person has COVID or they've had an exposure and you're still interacting within that space.
We would have to take a look at the details of how that might work. I can anticipate some issues with it, but you should know that whenever a student is moved out of residence hall space due to symptoms, whether they've tested positive or they've got a test that is currently being run, we send in the cleaning people. So that doesn't require notification of the RA. That happens through the routine notification anytime we've got a student who has or is specifically suspected of having COVID. And it includes the student's own room and the shared space in that housing area.
For sure. And then one small question and then kind of like a yes or no type situation. So with sports teams and, I guess a concern about them being in close proximity even through COVID, is there a reason why we're still allowing sports teams to this semester play scrimmages and also practice? And kind of like a second part of that question, will sports teams still be playing and practicing if we were to go into a pause?
I'm quite sure that if we were to go into a pause, there would be no sports activity, but that would have to be a decision made at the time. Several of the teams are currently practicing, and we are following the NCAA and Liberty League rules on enhanced testing for those student athletes. Depending on which team they're on, they can be tested up to 3 times a week and before any competition. Discussions are still underway as to whether there will be any competition between schools this semester. They're trying to make that happen because obviously the spring sports students missed essentially their entire season last year. But it will depend on how the numbers look over the next few weeks.
What is enhanced testing?
There's different testing requirements depending on whether it's a low, medium, or high-risk sport. But for high-risk sports, I believe they're tested twice a week.
Okay.
Okay.
I think, again, in the interest of time, we still have a couple people left. And so I do want to acknowledge that we did say that the administrators would only have to be here because this is late for the full 45 minutes up until 8:45. So if the administrators are willing to stay longer, we can certainly, you're welcome to stay. But I do want to be respectful of the time.
I'll stay. I might change in my pajamas, Alexander.
Okay. All right. Then again, feel free to put names in the chat and we'll keep cycling through until the administrators have to leave. So we can go to, I believe, Micah Greenberg was the next.
Yep, just some quick questions about following up on Grace about people who've already been vaccinated. So for students, first of all, if you've already been vaccinated and the 2 weeks have passed since you've gotten your second dose for the ones that need a second dose, will you have to quarantine if you've been exposed and you've already been vaccinated? And also, based on that, can people's behavior change if they've already been vaccinated? And also based on that, does the university track who's been vaccinated?
So both the CDC and the New York State Department of Health have issued guidelines that allow people who've had both doses of one of the currently available vaccines and are at least 14 days out from the second dose not to quarantine after exposure. However, they still have to quarantine after travel. Now, I can't explain to you why it's one way for travel and the other way for exposure, but that's the way it is. However, the Monroe County Department of Public Health has not yet implemented that new guideline because the state has not yet issued instructions for how their vaccination has to be documented. So, in some cases, if you're signing up for vaccine because you have an underlying medical condition, the state regulation is all you have to do is sign a statement that says, I have one of these conditions. Are they going to do the same thing for vaccine, or are they going to make everyone who wants to claim that produce a copy of their vaccine card or a statement from the person who gave it to them or something? They haven't decided that yet, so it hasn't been implemented here in Monroe County.
All right. I have now lost the list. So if anyone can see who the next person is, feel free.
I think it's
Leah?
me.
Okay.
Yeah. So I first have wanted to echo Andre's concern about sports teams and athletes to continue practicing. And I think a very similar concern that a lot of the student body is sharing is also about Greek life, because a lot of those groups are able to continue rush and recruitment, even to some degree in person, and athletes are able to continue practicing. And there have also been reports and rumors in the student body hearing about actually those groups being the lead, not really social distancing as much as they should be. But the question I want to ask is actually about athletes being tested more than the normal student body. Why is the school prioritizing testing athletes up to 2 times a week or every week when we're saying that we do not have enough testing capacity for other students who might have been exposed to COVID or who might be at a higher risk of actually getting seriously sick from COVID?
The University Health Service implements the decisions made by the university. We don't make that decision.
So just to follow up on that, who can we reach out to petition to change that policy? Because even though it might be allowed legally by Monroe County, by New York State, I do not think that is fair, and I think that should be changed. So who can I reach out to about this?
Celia, I would say that you can we can take it to, if you put something in writing, we can take it to the EOC, which would, I assume, take it to the CURT and the decision makers. There's lots of discussions that happen all the time about the priorities and trying to give students as much as they can the experiences of why they came. There are many students that came to the university specifically for the specific experience of being an athlete, through the coaching, through the things that, you know, may not be able to happen another way. And that's the only way it can happen. So I'm not saying whether it's right or not. I'm just saying some of the thought process that went into it, that it is a very specific experience that they were trying to preserve. And they've done the same with the high schoolers are doing it as well. Actually, they've been playing more than the colleges, which is very interesting. So, and that's been something that's happened, that when they were talking about the mental health and such, it wears on everyone. And I think it wears even more when that's been such a part of your collegiate life and then it disappears, and something that, you know, so that's just one of the things. But the other thing you were talking about with the groups, I think sometimes people get characterized that people have the hearsay of that it's happening from this group or it's happening from that group, but that's not necessarily always the case. So I think we should be careful about casting aspirations on specific groups. Sometimes it just happens that those people are friends and happen to be the ones eating together or doing things together, like, you know, Dr. Manchester was saying, in groups of 4 or different things that were actually legal, but because you're together and that's your friend group, then it, you know, just because they're all in that same friend group, then, oh, they were definitely doing something wrong, you know, and that's why they're bringing this all. So I just think it's better if we try not to cast aspirations on each other, but try to figure out how we can get through this together as a community and help each other be successful and safe, rather than trying to, you know, say, oh, it's your fault or it's your fault. I don't think that's always so helpful.
Maybe not, but you bring up a couple of good points, Leah, and I would encourage you to put them in writing. You can send them to Anne Marie and to me. We're both on the EOC. I'm not on CURT, but that EOC would bump it up to CURT and the decision makers. So I think you're bringing up good points, and there is some culpability out there. I'm not able to talk to you about follow-up if it does become a conduct case, because that is confidential. But there are a couple of cases that have gotten me frustrated as well. So I would encourage you to follow up and put that in writing, because even though it's come up before, it's helpful for them to hear it again.
Amanda, did you have a follow-up question? I think you were next.
Yes, I was going to ask Leah's question, but I have a follow-up. So let me phrase this in a nice way. Why is it the obligation of students who are suffering from poor mental health to continue advocacy that we've made very clear is the case? I think all of our experiences have gone down the toilet in the past 2 semesters. Speaking for myself, I contracted COVID, survived it. It sucked. It sucked a lot. And frankly, like, I'm a second semester senior who didn't really get to have a senior year. And I think the people that should be prioritized are the people who are experiencing symptoms, are the people who probably need to get tested as soon as possible to know whether or not they have corona or COVID-19. And that's sort of the bottom line. And it's not like we haven't said these things before. I'm sort of wondering, all of the current policies that we're looking at, yes, they came from a committee, but who made them? Who proposed them? When we make policies, did we set up data collecting measures to see whether or not they were working, whether or not they were effective? You know, we go to a school with a great public health department, with a really great, you know, political science department that does a lot of like models. I was wondering, in terms of the policymaking process, where is the accountability here? Do we go to the president? Do we go to CURT? Who do we go to when students are literally, you know, at risk of dying? And that's my question, because I heard from Dr. Manchester that, okay, UHS is only in charge of implementing policy that is given to them by the university, but who is the university? Who are we going to go to when, you know, perhaps not inevitably, but when we have perhaps a student who is our peer, our friend, contract COVID and go into, you know, a situation where they need to be put on a ventilator? and potentially die. Like we need to know who we have to go to get things done. And I'm sort of sick of these go to the committee, write a note, write a memo, it's going to get passed around and then something will happen. I feel like a lot of things at this university have gone that way starting from 2017. And I'm really sick of not seeing things happen as soon as possible.
So I guess I'll answer one thing with the modeling. I think that I don't think Dr. Manchester has given enough credit for the amazing things that his team has done, and they do use a modeling. I mean, the method that he's using with the surveillance testing, they did model that. They used our scientists and our different researchers to build that, and it's different than some other schools. Other schools test wastewater, other schools do different things, and we listen to the science and we listen to our researchers to what we have found to what we thought would be the best way of catching those random cases. And it really, really worked for us in the fall. It was really good. And I think it's working for us again. So I am really proud of what we've done in that. And I think also, it is difficult, Amanda, and I do take everything like Justina and the leadership here. They are on a committee where they meet with Dean Runner and Melissa Sturgapple. They meet with John Hay. They meet with people that are on these decision making, and they bring forth concerns. And I can tell you, all of them are brought forth in these meetings and talked about, and they try to make changes. They really do. You saw the chatbot change. I can tell you that comment Ian brought up when you guys brought forth the concerns about Halloween. I mean, we really tried to listen, and we really tried to go to town and change and make a whole bunch of activities that would be safer so that, because you guys were very worried that there was going to be a lot of, unsafe activities. And we put forth time and effort. My entire team was here that entire weekend doing programs and things. So I know it seems really hard. Trust me, I have a student that's experiencing the same things you all are. And I see it. I see in all of you. You're not the same students that I meet with on a regular basis. I miss seeing you. I miss being in person with you. We are trying really hard, but we don't just take your notes and pass them. We actually try to make difference. So please, when we say that, we mean it with all earnesty. Get it to us, because if it's not the reason we want to say put it in writing, because it helps us bring it forth in a coherent way of your exact point, rather than us trying to paraphrase what you're trying to say. That's the reason that. And they may bring you to meetings after that to say, okay, can you come and talk to us about that? So generally that's what happens. And I don't think there's, if Alexander, Justina, any of you try to get any of these students in front of any of the deans or any of the administrators, even the president, I don't think you've ever been turned down. You can tell me differently, but I don't think there's not been open access and people making good faith efforts. I wish, we could do more, but I would say that we are trying to use models and science and data to make these decisions.
Yeah, I think that's right. There's a lot to what you said, Amanda. So I appreciate your comments. And I hear the emotion behind them too. So I just want to acknowledge that. But we can do more. The reason I asked Leah perhaps to put some things in writing, it adds credence to my words. At a lot of these meetings, you hear people say, well, I heard that there was a student who said this, or everyone is saying this, when they don't have something that they can point to and say, so for instance, if I got it in writing from Leah, I would say, well, a member of the student senate took the time to write and tell me this. So this is, it adds some validity to the advocacy that I can promote for you. So, but that frustration, that doesn't mean you have to be the person to do it all the time. There are a lot of you, and you don't have to do it. We're going to bring these things up regardless of whether or not you put this in writing. So now that we heard that concern, I will bring that up. But when I'm talking to a committee and I say I received a letter, that is an indication that someone took the time to put these things down. And so it just adds credence to it. But it is not your responsibility, Amanda. You're right about that. But it is helpful to us who are trying to advocate on your behalf.
Yeah, I'm not sure I understood you correctly, but we do prioritize testing for students with symptoms. We can get that done the same day. If anyone is experiencing anything different than that, they should bring that to my attention immediately.
All right. I think we can go to Ian.
So thank you so much, Alexander. I would like to just, if you'll allow me, take a moment to just kind of establish context for my question. So I first want to say I live in a building on campus that belongs to an organization of which I'm no longer a member. And from that, I want to say that last weekend, this organization experienced kind of a number of exposures among a large number of people. And I would also like to state, just for the record, that I do have their permission to share some of this with you all. So the day after that these contacts were determined to have happened, the individuals who were exposed to the positive case were told that they were going to be moved off campus. And this would happen relatively quickly, and that they would be moved to off-campus quarantine hotel as is usual policy. As that started happening, including some of those students that I mentioned already arriving at the hotel, a decision came down that reversed that decision, and was then told to all of us that instead, all students who were exposed would be remaining in the house, and all students who were not exposed would also be remaining in the house. As somebody who wasn't exposed, that obviously created a lot of anxiety for me personally. At that point, there was no communication to anyone directly about what was going on. As somebody who wasn't exposed, I felt that my health and safety were put at risk. And by nobody kind of communicating with me directly about what was going on, I felt abandoned by the university. And I felt like there was nobody to turn to try to communicate my concerns and try to establish what was going on. Luckily, I was able to get in contact with Justina and kind of work as quickly as possible to establish what was going on and try to get some sort of remedy to the situation. And then at the end of the day on Saturday, a day later, I just decided that I was going to put matters into my own hands, and I went home for a week. But a number of students didn't have that luxury. A number of students didn't have that luxury to go home like I did. And they were stuck in the house over the weekend while their health and safety were put at risk. And then on Monday, the decision was reversed again. And students who were exposed then got moved into off-campus quarantine, along with a number of students who weren't exposed. But because they were there over the weekend with the students who were, they had to be moved. So my question is, and there's a lot more details that I can go into, but that's just a brief overview for those that weren't aware. What happened? Why did it happen? And what are the steps that are being taken to ensure that it won't happen again?
Yeah, that was not our finest hour. There were decisions made on that Friday that should not have been made. That decision-making process has been clarified at the highest levels of the university, and that kind of situation will not occur again.
So just to kind of clarify then, if somebody were in my situation, will they be receiving direct communication from the university acknowledging what's going on and saying, we hear you, we see you, and we're trying to keep you safe? Because that's all I needed, right? That's all I wanted, was just for somebody to reach out to me and the others who weren't exposed to say, we see you. We acknowledge that you are unsafe right now, and we're going to take the steps necessary to make you safe. Because the entire weekend, if I had stayed, I mean, I literally had to assume a sort of de facto leadership role within this house to establish policies for everyone to adhere to regarding the shared bathroom that we use. I had to say, we are going to establish a group chat so that if one person enters the bathroom, nobody else will enter the bathroom. It was a complete, and again, I usually and try to be as understanding as possible when it comes to university policies. I I was in SA, I get it. I try to be as diplomatic as possible, but this was a complete failure on the behalf of the university. And I just, the level of anxiety that I experienced while I was here was something that I hope to never experience again. And I hope that there really will be further communication down the line first, if this ever happens again, so that the students in my situation, if this does unfortunately happen again, will not feel the same things that I felt.
Well, the goal is for it not to happen again, because once UHS makes the decision that certain students need to go to quarantine, those students will go to quarantine.
Yeah, and Ian, I feel horrible about what happened last weekend. And, when I saw you briefly during Winterfest and was able to sort of just put eyes on you, just felt, it was not a good situation by the university. And I was in the meeting that Ralph was describing where we did say, yeah, this was wrong and this won't happen. And they rechanged what would happen. So I think you can trust what Ralph just said, that the decision has been changed, that will not happen again, and that different things have been put in place so that is not what would happen again, and people would be communicated with appropriately and brought to the places that they should be going to.
I appreciate that. I really do. And just one last, Dean Burns, I'm not sure if you wanted to jump in there.
No, I'm going to say, yeah, that was a failure in decision-making, Ian, that we looked at. And I think looking at particular living units like houses that you're in as independent from other parts of the university was a mistake. And I think that's where some misinterpretation came. But since then, Dr. Manchester is right. That's been clarified, that should have never happened. That was a failure on our part. And we recognize that it's a failure. I recognize that that's a failure. Anne Marie was texting me at 11:30 at night to try to figure it out. And I know she and others were working throughout the weekend to try to figure that out. That was a failure. That failure has been assessed, and I trust that it's not going to happen again. So I don't want to backpedal and say that we didn't do anything wrong. We did. We got that one wrong.
And I for taking up other people's time, but I do think that this is an important event that needs to be kind of clarified. Just two last points. The first one is I do hope that an apology will be extended to those that were affected last weekend. I really think that would be really important to establishing that there was, because I only heard, from third parties that there was an acknowledgement of failure, right? To this day, nobody has reached out to me and said, yeah, what happened was awful. And so I'm just hoping that some sort of, recognition can be made about what occurred. And then
I'll do that, Ian. I will make sure that happens.
Thank you. I appreciate that. And not just me. This is not about me. I'm trying to raise the concerns of several other people to this meeting that weren't able to attend. But then beyond that, just kind of as a detail as to what happened. And this actually happened to me. I, again, wasn't exposed, wasn't even here when this happened. But last semester, a similar situation happened that happened to others that I know of this semester, where the date of exposure that New York State has on record is different than the date of exposure that UHS has on record. And I'm wondering how that happens, and if that's going to be an attempt will be made to rectify that and ensure that those dates match. Because back in November, when I had to be in quarantine, the university told me that I would get out on a certain date, and then New York State told me that I was actually getting out several days later. And so I was kind of in this gray area of, I don't even know when I'm getting out. And that obviously established a whole lot of anxiety on my part, because I'd only packed for a certain amount of days. And that also happened to a number of folks that over last week, where UHS and New York State dates just did not match up. And there were a number of times when individuals were just not sure when they were getting out of quarantine. So I'm wondering if that specific area is going to be addressed in the future as well.
That will continue to happen. UHS does its contact tracing as soon as we get a positive test. Monroe County Department of Public Health does it when they get the positive PCR result, which could be a day or 2 or 3 later. In the intervening time, in some cases, students either see something on their calendar or talk to a friend who gives them different information. And then it goes into the New York State system with the information that the county contact tracer gets, and it's not the same information that we got. Legally, it's what the county health department says that determines when you may leave your isolation or quarantine. Now, we also know of at least a couple of specific cases, and there may be others, in which the student figures out, hey, if I give an earlier date to the county health department contact tracer, I will get out of quarantine or isolation that much sooner. So that is what it is. But the discrepancy between the date that UHS sets and the date that the county or state sets will continue throughout the pandemic in some situations. And it's the county and the state that have the legal authority.
Thank you. I appreciate your explanation, and I do apologize to everyone for taking up the time. There are a number of other things I could dive into to ask for explanations on nuanced details where I think that there was a breakdown of either communication or decision making, but I won't for time. I know everybody appreciates that much. So thank you again for answering my questions. I do appreciate it. And with that, I'm done, Alexander. Thank you.
I think we have 2 people left on the list. Or actually 3. So we'll try and do it quick, so that, because again, for the administrators, it's I know it's rather late. So we'll go with I think Alex Figler was next. Senator Figler.
Yeah, hi. Getting into more generalized topics. There are obviously parties happening. They were happening all of last semester. I'm well aware that they're occurring. I'm sure you're well aware that they're occurring. And I know you say that, oh, it's up to deliberation of whoever the issue is raised to, but these events are in clear violation of the guidelines you've set forward, of the guidelines New York State has set forward. What are you doing to hold individuals responsible for both hosting and attending these events? And what are you doing to prevent these events from continuing to occur? Because they continued to occur all of last semester. It's a pressing issue that continues to happen. And I don't see any action being taken to stop them from happening.
I'm sorry, Alex. I'm trying to, in my head, figure out what I can say about the conduct process and what I can't. We're aware of many of them. We aren't aware of all of them. We're aware of the circumstances of some of them occurring in different venues where the university doesn't have complete jurisdiction. We're also aware of some of those events happening where we do. You won't always necessarily hear what the sanctions are for individuals. You won't hear individual sanctions at all, but they have occurred. And for the groups, it's harder to hold a group accountable. There are a series of questions we have to ask in order to hold an entire group accountable. But there are a couple of groups who are facing conduct charges. And so in the interim, while there's an investigation into that, a lot of times what we'll do is we will suspend their ability to hold any events at all. That's happening with a couple of groups. The information isn't always perfectly clear or have sufficient evidence to result in a responsible verdict. So some of those, or a finding of responsibility. So some of those cases, you're right, they have not received sanctions. Typical sanctions could be, certainly the first thing with groups is to look at their ability to host events. But it doesn't end with the group either. So there are some circumstances where an event has occurred and only a couple of people face the charges because they were found to be the hosts, or those are the only people that we had sufficient evidence against. And then there are incidents that are happening on campus that, as much as all of you are aware of it, it doesn't come to our attention because I'm not on campus on Friday and Saturday night to wander around. And maybe that's the solution. Honestly, Alex, I hate to try to monitor your behavior when you're supposed to be responsible adults, but maybe we do need increased supervision to get some of these into reports so that they can make their way into the conduct process, or to gather the evidence necessary to hold individuals accountable. And we need more than the eyes and the ears we have on the ground right now, because clearly we're not catching it at all. So some of what you're saying is absolutely, we're not catching all the violations and are not being held accountable in the conduct process. But once you do get into the conduct process, it's not as simple as this group is doing that or that individual is doing that. There is a process we need to follow. And then at the end of the process, if there are individuals that are being held accountable, unfortunately, you're not going to know about it. And I'm not going to be able to call you up and say, Alex, you know, X, Y, and Z were kicked off campus because of their conduct. And so I don't know what more to say about that, other than I know, I've heard, I'm aware of some cases. Some cases are in the conduct process. Individuals have been held accountable. And I can't give you really specific disciplinary information about other groups and individuals beyond that. I don't know if I've answered your question well enough.
So it seems like most of your efforts for these parties are after the fact. There's not measures being taken before a group may attempt to host an event to prevent them from hosting an event.
How would we do that?
Well, I mean, I think that actually, I like for the fraternity community is one example. I mean, John and Casey from Fraternities Research said a very strong message to all the groups saying, listen, our numbers are up. We don't want you to be part of this. You know, you cannot host parties right now. You reminded them of all the things, let them know that there would be sanctions and there would be serious sanctions if their organizations were found to be in violation. I mean, he did take some proactive steps, you know, talked about the positive things they could do, the safe, you know, things they could do to help campus. But what are the things that if you start doing these things and you're caught, you are going to face serious sanctions. So I think that our different organizations, we you know, had Dr. Manchester send a letter to, you know, the whole community, letting them know what kinds of things are happening right now and for us to be extra safe. We're trying to plan more events that are safe, you know, that people can come out to in socially distanced, masked, sanitized ways. It is hard to be more proactive. We do have the COVID concern form as well that people, I can tell you, they do fill it out because I've had to have people that I've known that have had to go through conduct due to that as well. So we're asking community to help us, right? Like Matt said, he's not there, but if you're seeing something and you write a report, it will be followed up on. So I think we're trying various ways. I think she was asking about the serious sanction. As we were saying, talking about the group not being able to do things on campus. I don't have the exact things he wrote up, but there's a specific.
And that's a better answer to Alex's question, Anne-Marie. So thank you. But John did send a message out saying, if you're involved in this, here's what you can expect to happen. Everything from taking your ability to have activities away. We have disaffiliated organizations before. We have removed them from their privileged campus housing. Those are all on the table. I don't think we've done that yet to any group. We can take a group's recruitment privileges away. That is something I think we might be considering for one group in particular, which is their lifeblood, right? So there, serious sanctions with regard to groups, those would be the series of steps, you know, activity privileges, recruitment, living privileges, and then disaffiliation, just unrecognizing from the university, which is the last step. That's sort of like expulsion for an individual, right? And then I think I mentioned some of the sanctions for individuals. We start with repeat offenders or blatant offenders with deferred removal from residence. That's kind of like, depending on the circumstances, it could go up or down from there, but that's kind of like where we start the conversation. I didn't mean to be blithe about what would we do to prevent it, but what came to my mind, Alex, was like, okay, we need a minority report sort of thing, so to look at the pre-crimes, right? So I'm thinking, how do you proactively address a violation that's about to occur? And I don't know the answer to that. That's, I guess, where I was going, but Anne-Marie's answer is much better.
I can weigh in a little. Sorry, go ahead.
Well, I think we can give space if Emery wants to add anything to that or ask any questions. regarding the social events, parties, anything of that nature? And then if not, we can, are you asking a follow-up, Amanda?
No, I just have a thought about how you could stop it before it happens.
Okay.
Can we
tell.
Sorry, am I recognized, Alexander?
You can share your thought, yeah.
I think one of the biggest reasons why groups, in particular fraternities and other student groups perhaps, feel the need to continue violating guidelines is that they believe them to be untouchable. And I think this has been the case for a very long time, is that the students who think they are untouchable will not follow guidelines, will continue hosting parties, will continue to be in violation. And frankly, it needs to get around to them that they're not untouchable. And that comes with accountability, that comes with perhaps potentially public accountability, in my opinion. And to some extent, that's happened, where people are getting quote unquote social media canceled for various things. But the important part is that we are truthful to the student body and that we are able to tell people what is actually happening. And it's not just rumors, right? Iman just said in the chat, it's all the people who have never been told no.
Okay. Yeah, we've had that conversation about should the group conduct process be the same as individuals? Like, it would be against the law for us to share individual disciplinary information, right? But it's a gray area as to whether or not it is really against the law to share group information. And to be quite honest, we have commented on that in very isolated cases in the past. But that's a good suggestion. Maybe it's time to bring that up again, especially in the context of COVID-19, right? Whether or not we really need to keep group disciplinary records confidential, or whether or not we can make those a little bit more public. It's a good question. It probably does need to be asked now. So thanks. I'm glad that you made that. Thanks, Alexander, for making time for Amanda's comment.
I just want to also point out the thing Typhoon just put in the chat, because that is something that had come up from previous student submissions as well. We didn't include it as a specific question from the sort of moderated portion beforehand, but it was something that we've discussed in Kurt and other areas. So maybe if we have time, we can discuss it here, but I think that's definitely something to potentially even have it as its own town hall, is just on the explanation for why COVID rules are the way that they are. So I think the next on the list was Grace.
Okay, I'll try to be quick. So double masking, as we know, is kind of becoming the general medical recommendation from what I understand with the new COVID variants if you don't have like an N95. And I often see kids on campus with just like a very thin cloth mask, and I'm not judging, but I think the university should be putting out some sort of recommendation, because this new variant, all the new variants coming in are going to overwhelm the existing policies we have if we're not already changing them. And my question is, are we distributing disposable masks so that kids have the ability to be double masking, if cost is an issue for them? Are we at all like doing policies to adapt and prepare for the more contagious variants that will hit our campus this semester? Because we won't, I know you're saying you're doing the contact tracing to the state's recommendations, but at a certain point, like that contact tracing just won't be effective with how contagious the new variants are. People are just getting infected and you don't know where you're getting it from. So I'm just curious, like, how we're going to adapt, like, in the masks.
Yeah, the CDC just put out their new mask guidance last week, and we're reviewing that. It was more advisory than mandatory type guidance. And there's some concern that if we put too much emphasis on the double masking, some people will think, well, I can't double mask, so what's the point? I'm not going to wear a mask at all. But we need to finish our review of this new recommendation and then look at how we might be able to supply the paper procedure masks, which are already a double layer, and then how to help everyone understand that it's a combination of how the mask is made and then how it is worn to give the optimal contact between the mask and the skin all the way around the edge of the mask, because the air that's flowing out around the mask is not being filtered by the mask going in or coming out. So that's what we are in the process of reviewing. The prediction is that it'll be next month before the variants start to become the predominant source of infection. So we've got a little bit of time to figure this out and then look at whether we need to find sources for other kinds of masks.
With all due respect, I think we do have time, but the places that this virus is going to proliferate in are going to be college campus settings, because you have kids on top of each other, you have kids eating together unmasked, and I don't mean anything against what the committee will be going through to recommend that, but I also think we are a world-class institution. We have a lot of kids here who are trying to go into public health medical fields, and I don't think there would be a lot of resistance to double masking if the university simply said tomorrow, hey guys, if you can, please double mask on their Instagram or on any of the media they're sending out. I think that should be a recommendation because kids listen to that. I think there is some degree of respect for those emails.
Thank you. We will take that to be part of the plan.
And Grace, one of your points I think was about the cost. If there is ever anyone who you hear that cannot afford a mask, please right away get them to myself, Matt, anybody in student government will quickly get them to us. There are places that we have that we do not want anybody to ever feel like they don't have enough funds to get the proper PPE equipment. Please make sure that you bring them to.
All right, Micah.
Yeah, so I just wanted to sort of circle back to some of the like mental health, social life kind of topics to sort of just give some perspective that I've seen about that. I think that there are a lot of things that are like, I think administration tends to sort of understand that it's difficult and that like people aren't socializing as much and that's difficult. But I think some of the specific aspects of it and nuances of it are a bit less well known. So I think for me, at least, the two things that I've seen the most as being difficult are, first of all, that the only places that you can socialize with people are very in public. So specifically, that means that you can't have really, I'd say, deep conversations, especially if you're going through something, to sort of have the mental support in those situations, because the only places where you can have real conversations with people are in Hearst or in the dining halls. And the second thing that comes to mind is that sort of because people are no longer on campus as much, and they're in their rooms more often, they don't sort of have the happenstance encounters that might not cause that much spread because you're masked, you're only doing it for a couple minutes, but it really limits your social circle and you're only ever seeing the people who you can schedule things with, which is just the people who you both feel comfortable enough to schedule things with because you're close enough with them and you're comfortable and sure that they're following COVID policies to the extent that you're comfortable with. So I think it's those two aspects are the two things that I would really be looking for ways to solve. If I don't think they're solvable, but like at least mitigate.
Yeah, Micah, I hear you. I mean, what I hear most is they miss being in like the iZone at night on a, Friday night. Our students, that's how you studied in groups. You met people, then you said, hey, let's go get something to eat. And you ran into all different people, right? You didn't have to actually text somebody to set up something and worry, who did they see, who I didn't. We get it. I hear it all the time. Trust me. Not only like it's, and we can see it when we're on campus. It's not the same. There are the study rooms. I don't know if you guys have gotten the info. I know that Justina and others are working in your social media, are working on getting some of the resources. And like I said, there's the presentation next week where you'll see what the Climate and Care, they've really put a lot of these resources, the You Are Connected program, where you can have a one-on-one with a peer to get you connected to either the mental health or to more of the social resources. But there are rooms that you can now reserve. So you can have small groups. So you don't have to be in public. If there's like 3 of you and you can be socially distanced and have one of these rooms to do your studying, to do your thing, where it can be feel a little bit more, like it was before. So please know that we are hearing that. We are trying to make adjustments, and there are some things. It's just hard for us to get those out to you, which is why we're trying to work really closely with the student government to help us get it out, and the class councils, because we know the peer-to-peer is much more, because you don't read at Rochester Always, you don't read our emails that come. You guys do, but I think more than the average student. But I know everyone's kind of fatigued by reading all those things, and you don't know, like you said, where do you get the right information? So we do struggle sometimes knowing how to get this to you when we do make things change that will help you. So I'm really glad that you're doing things like this tonight. And I know you guys have been really receptive to helping, put out resources and share it on your social media. And we want to get that to you as much as possible so that you can get that to the rest of the student body. So that when we do have things like, I know like, those rooms, if you need to do Zoom calls and you can't do it from your room because your roommate's there and you need privacy, we have spaces you can use for those things, right? But not everybody knows that or knows how to access it. So the more you guys can help us in spreading those information, that will really be helpful.
All right. So we've got 2 more, and then I've been checking, and I think they're going to be somewhat quick, and then we can hopefully let the administrators be able to go back to their home lives and get sleep and all that. But we really appreciate you being here. And I think the next person was Sabit.
Hi, yes, thank you. Can you guys hear me properly? I'm on duty right now, so I'm also trying to make the best of my time. Firstly, a few concerns that I just want to be noted, and I think the university, especially the administration, could reflect on and possibly work with residential life on, is putting the duty of taking responsibility and regulating the rules and policies, especially of the guest policy on student residential advisors, is inherently such a big issue because A, it puts all of the RAs at risk of straining their relationships personally, and also putting them in a position where they have to consistently confront people who are the same age group as them to follow a policy that not only is damaging to the mental health of a number of students, but also a policy that's almost impossible, if not actually impossible to impose. But beyond the concerns that I want noted, I think one of the really important questions that I want to bring up is the general issue. Is the general issue around the university not recognizing the academic challenges that are posed to students from socioeconomically underprivileged or not as privileged backgrounds, and that indirectly affecting their ability to pursue academics at the same level as other students. And I want to get a little bit more in depth into this. So the example that I'm specifically trying to explain is, for instance, students who are able to afford memberships for Greek life organizations, et cetera, or clubs, and et cetera, that allow them to consistently socialize or live in residential areas where they have a group of friends they can consistently interact with. For them, it's slightly better in terms of them being able to socialize and maintain a social life, and therefore it not affect their mental health to a point that it affects their academic progress at school. However, there are a number of students on campus who struggle with socialization, which has had a detrimental impact on their mental health, which in turn adversely has impacted their grades. What are some measures or some conversations that the administration has had so far in order to help those students from underprivileged backgrounds, from backgrounds that are not as socioeconomically strong, or from social situations that aren't consistently amicable or good or conducive to their academic learning, to support them consistently? Because I know there are a lot of programs that are being pushed through RAs and all of that, and most of them include peer-to-peer advocacy and stuff like that. But why so far, at least almost a year into the pandemic, have we not seen some active progress in terms of making sure that there are safe spaces for students from these specific groups, from these specific demographics, who need this ability and time to socialize, to be able to interact with each other so that it doesn't impact their mental health, considering that they already have a number of other issues, specifically For instance, like students coming from financial insecurity backgrounds, which leads to them not having jobs right now because of the pandemic, we're having to work extra hard to make the same amount of income, and therefore limiting their ability to, pursue their academics at the same level. And at the same time, why are there not specific academic accommodations for them that have been at least promoted or shared through a student government, like push to student government and further, and also by the admin and management themselves, especially the Office of the Dean of Students, because as I understand, the main purpose is to support students in their time of need. And I believe that students specifically from these underprivileged socioeconomic backgrounds are at great risk of mental health issues and damage, and that in the long run impacts their ability to be in a conducive environment where their mental health allows them to progress, as well as students who, for instance, are, say, from a much better socioeconomic background, allowing them to get better grades consistently. And on that, effectively, why at this point do we not have policies in place that allow for grading that is more equitable, especially for students and towards students who come from backgrounds that are not as well off as others? Thanks.
Okay, so there's a lot. Sabit, hi, by the way, good to see you. Let me try to get at some of what I remember about your comments. First, I think our efforts have been geared toward individual students. There's been a lot of work to try to get students who are in need of resources, those resources more quickly. And so I think most of our efforts have been geared toward individual students who are in need of support, specifically and especially financial support. I know Alumni Affairs have been working to create an emergency fund for students. Dr. French, who has contributed money for years toward that purpose, has given more money. And the Basic Hubs Need website was created to try to streamline those students who need something to get something. You also mentioned, though, the broader, what about groups? Those who are from backgrounds that can afford the dues for fraternities, sororities, for instance, can do that. I'm going to need to follow up with Jessica a little, Jessica Guzman Ray a little bit, because I know she's been looking at that and looking specifically at the intercultural center as a space where that sort of can occur outside of the language hours that the language center has. You probably know they share space. So I might have to circle back to you a little bit, Sabi, on what we've been doing for specific groups and to try to create a hangout space, particularly with the issues that you talked about in mind. So I don't have a really good answer for you about that tonight off the top of my head, but I can find out more from Jessica in following up with her. The last thing you mentioned was a grading policy, and that's beyond my purview a little bit. We're going to have to get Dean Runner involved in the conversation, maybe even Dean Hall, who's the Dean of the Faculty for Art Sciences and Engineering, to talk about what, if anything, can be done about that. Those are the three things I remember off the top of your head and all that you said. So do you want to remind me of one or two other things? I may or may not be able to respond to them, but they slipped out of my head.
Yeah, I think I can. I think the other question that I specifically had was, why are there not specific social places designated for these students? And I think you've mentioned how they are allowing students to reserve rooms at this point, but specifically, why are there not avenues for students from these specific backgrounds, and why are they not being reached out to by the university proactively rather, to ensure that they have support mechanisms that other counterparts of theirs already do because of the background they come from? And in effect, does that not go against, like, our policy of our motto of always following up and living up to the Meliora values, especially that of equity, because that's the greatest concern in something of this grand a magnitude.
Yeah, I think that's a larger issue than COVID-19, because I think that issue has been with us for some time now. And I know the Kern Center has done a little bit of work on that. I know Jessica has. And I see the comment in the chat about special interest housing. And we've gotten at some of that throughout the years, but clearly not enough. So I don't know the answer to your questions, to be other than following up with Jessica and seeing if we have a little bit more for you. I don't know that we've done an awful lot there and probably need to do more.
Thank you for acknowledging that.
All right, and then we'll go to the last question from Amanda.
I promise these are really short. The first one is, so last semester we talked to Dean Hall and Dean Runner about academic policies. And then we talked to all of the heads of all the department chairs about sort of basically students are continue in the spring. What should individual students do?
Amanda, I think you broke up halfway through your asking the question.
Long story short, if sir is still assigning me a bajillion projects in an unreasonable manner, what do I do?
Yeah, I think that's a Dean Runner problem. I would send him, I would communicate directly with Dean Runner.
Okay, and then a second more medical question. So we know that there's a medical amnesty policy specifically for alcohol. I was wondering if there would be possibly a consideration for some kind of amnesty with COVID violations in the case there is a medical emergency.
That's for me. What I'm sorry, Amanda. Again, when you said a medical question, I started reading the chat, so I'm going to have to ask you to repeat that question again.
Sure. So we have a medical amnesty policy that applies only to alcohol usage. I was wondering if it would be possible to have one where students are protected if they call MERT in a medical emergency situation where the violation is not alcohol rather than but rather a COVID violation.
Yeah, I don't see why we couldn't throw that around and see if we can come up with a policy that's similar to it. Medical amnesty works pretty well. And so if we can outline the criteria for looking at that situation and include it in the medical amnesty policy, we could probably do that pretty quickly. That's a good question. All right, let me write that down. And I'm sorry, I didn't mean to ignore you, but I thought it was a question. It was going to be geared toward Dr. Manchester, and it wound up being me.
Well, I think we ought to take a look at that. The medical difficulty is that almost any symptom can be caused by COVID. So we'd have to come up with some way to determine that, yes, a reasonable person would think that they were dealing with a COVID situation, but that's going to cover a lot of medical calls over the course of the semester, which may be okay, but we just need to be aware of that as we have the discussion.
Thank you. Those are all my questions.
I had one question along those lines, just like very related, if I could go ahead.
Sure, let's try and make it super quick though.
Yeah, it'll be super quick. So just along the lines of what Amanda asked, in a lot of cases, we see that sexual harassment reporting has been sort of affected because students are scared of the repercussions of COVID policies. In those cases, what would you say the exceptions would look like? Just because there have been no information regarding that from the university administration regarding what happens if you do fall in a situation where you have violated COVID policy, but there has also been a sexual harassment case that could be filed and you could be scared of the repercussions. So what would you say happens in that situation? Thank you.
Sorry, my space bar wasn't working. That's an excellent question, Rustam. I'm glad you brought that up. And it's something I probably should have considered, but haven't yet. I don't believe that in any case that fear of repercussions from violating COVID-19 should be preventing someone from reporting a sexual misconduct. That should be clear, and I think you're absolutely right. We should probably clearly communicate that if you're reporting one of these serious violations, sexual misconduct may not be even the only one of them. But that's a great question, and I think that needs to be made perfectly clear. No one should fear a COVID-19 conduct violation, getting held accountable for that because of reporting a sexual assault. That seems ridiculous to me, and it is probably something we need to make absolutely clear. Thanks for bringing that up. I've written it down.
Of course, thank you so much.
All right, well, thank you so very much to the administrators who came and on such short notice. I think as was pointed out earlier, it was only a matter of a few hours that they had to prepare and be able to come to the meeting. So thank you so much for making the time. And thank you to all the students who came to help ask questions. I felt like this has been a really productive and great session. We're going to be reaching out with some more information on our various social media platforms on Facebook and Instagram with the follow-up. I believe earlier in the chat, there was also a form. If someone can send that as well, but there's a form for submitting additional questions. If you have things that weren't addressed or that you want to address privately, we're happy to communicate those to the administrators after the call too. We're going to be having a Senate meeting right after this. It'll be super short because we're running very low on time, but it was going to be a short meeting anyway. So you'll have an opportunity if you want to discuss anything further in open forum. So with that, I will say goodbye to the administrators. Thank you so much for coming.
Thanks for having me.
Thank you.
It's good to see all of you. I miss you. Bye.
Take care. All right. Well, good news is we are already recording and live. So now when we go to start the meeting, it'll be super easy. So I will now call to order the Senate meeting of February 15th, 2021. And I will screen share the agenda. Would the Deputy Speaker please call the attendance?
Yes. Okay. Senator Ari Narkin. Senator Baker.
I'm here.
Senator Belay. Senator Dillingham.
Here.
Senator Fegler.
Here.
Senator Hawk.
Here.
Senator Hathaway.
Here.
Senator Cosby.
Here.
Senator Liang.
Here.
Senator Liverpool.
Here.
Senator Nadeem. Senator Changase.
Here.
Senator Rogers.
Here.
Senator Sadi.
Here.
Senator Salimi.
Here.
Senator Tulloch.
Here.
Senator Yoon.
Here.
We have 14 present and 4 absent.
All right. So we're now going to sing an abbreviated version of the Genesee. I'm going to try to make it as quick as I can. Full many fair and famous streams beneath the sun there be, yet more to us than any seems our own dear Genesee. We love her banks and stately falls, for to our minds they bring our dear old alma mater's halls where sweetest memories cling, as flows the river gathering force along her steadfast way. May we along life's devious course grow stronger day by day, and may our hearts wherever we roam forever loyal be to our beloved college home beside the Genesee. All right, would a senator like to read the land acknowledgement? Senator Salimi.
We would like to acknowledge with respect the Seneca Nation, known as the Great Hill People and keepers of the western door of the Haudenosaunee Confederacy. We take this opportunity to thank the original caretakers on whose ancestral lands the University of Rochester currently resides in Rochester, New York.
All right, thank you. So we are now going to go into open forum. Just as a note, we did still sing the Genesee because by my count, it's been several hundred Senate meetings since we haven't sung the Genesee. So in the sake of tradition, we can continue with it. So Senator Liang.
Yeah, I have 2 comments. The first one is I think that meeting was more productive than the first 3 months of the whole of last semester. to speak plainly. And secondly, I think that it would be really great if we could continue having direct communication in a public open forum with administrators instead of behind closed doors, instead of being in their offices, because that was the most productive conversation I have ever had with them, period. And following that, I don't think that the Q&A should be sent to them for them to mill over and reply. I think those questions should be asked to them in real time, in person, by the Senate body or by the student body as a whole in a public forum such as Senate or a town hall. I yield.
Senator Salimi?
Yeah, I was just gonna second what Amanda said. I think everyone confronting them about it really got them to give us some substantial answers rather than just like vague emails that they sent us at 8 a.m, which like, I mean, they're like always very vague. So I definitely agree with what Amanda said. And I don't think that I definitely think we should compile the concerns and stuff and then do a town hall or like some sort of like meeting like this.
Do you yield?
Sorry, yes, I yield.
Okay. Is there any other discussion on this topic, on the Q&A, the meeting, those sorts of topics?
I wanted to say something, Senator Hawk here.
Sure.
So
Senator
I
Hawk?
think, yeah, so I think a lot of their answers were that they haven't thought of something that we brought up. And I think it's sort of concerning that the students have to bring up something that they had a year to figure out, that they're paid 6-figure salaries to figure out. And we are the ones still reminding them of things such as sexual harassment policies being, clearly outlined, such as guest policy being clearly outlined, and such as their efforts to deal with parties and other issues. So I think that is kind of concerning, and I think we should continue to put them on the spot like this, because the reason that they were so open about speaking about things were because this is live, this is probably being watched by a lot of parents, and they were held accountable really directly. And I think that rarely happens because they can sort of send an email and get it done with and just be like, we're going to get back to you. But I think directly asking them questions and, demanding for answers was like a very efficient way to do this. And I think we definitely need to do it a lot more if possible. And I think this was a good discussion on our end. And I'm really proud of all the people who asked questions and put them on the spot. And that was really great. So thank you. I yield.
You yield. Okay. Senator Liang?
I fully agree with Rusama, or with Senator Hawk. I want to sort of turn the question around to leadership, please. I want to know if the conversations you have been having with administration in general have been as productive as this public forum, and if they have been, why are we not included in that? Or rather, if you have been having conversations and they haven't been productive, why haven't we heard about that either? Because these are not concerns that we should be coming up with by ourselves as senators. There should be questions that I'm sure leadership should be coming up with as well. I yield.
Do you yield to President Gorka?
Sure.
Cool. So we use a lot of the forums like here at Senate and also our communications with individual students to sort of solicit concerns, immediate concerns around COVID. And oftentimes we can resolve problems through email correspondence, but also going back to our old Senate agenda, how we had the CURT advisory or CURT student subcommittee advisory group. We bring updates from that meeting there. Oftentimes those meetings have agendas, but there's also portions where we bring forth things that we've heard from student body. So I mean, the most recent thing that just happened was today, resolving the issue with Dr. Chatbox, the repetitive reminders. So it's stuff like that where we're on the fly, that we have a quick email correspondence to resolve. And I would say that they're relatively productive. Sometimes we give suggestions, they don't end up coming or they don't end up manifesting in any sense. I feel like Amy mentioned that on the call. Sometimes stuff gets brought up to the larger CURT committee and they just drop without really necessarily giving us a reason. But, for one point or another, there are concerns that are brought forward. And I think Xander would have to recuse himself if I were to ask him, his perspective. But Connor, if you're on call, I don't know if you have the same opinions as I do on, trying to overall look at the advocacy that we've had in place the last couple of months. But
Yeah, I guess I can talk about it a little bit. I just have a variety of constraints because of confidentiality and other procedural things that get in the way. I think somewhat related to that, I think within my capacity, I've tried to loop in senators in particular to a few meetings that I've had, especially ones concerning the student life, student advocacy, that sort of thing. I think leadership as a whole has been pretty dedicated to trying to place as many people as possible who are going to have an impact on ways in like that information gets the way up, because right now we are a stack of committees on committees on committees, and that goes all the way up past the Students Association into the admin itself. So I think genuinely our SA's approach to staffing, it's been shuffling around a lot, right? But we have more students on committees than I think we ever have had in the past. I think arguably we have twice as many students on university committees now as we did, a year ago. Just because both the function of there are more committees, but there's also more to do. So that's a thing that I really want to highlight. But I've had frustrations, plenty of them, when it comes to what I think is important, what I think is the university should be doing, what I think students want. I think I've tried to be as open as I can with members of SA in particular, because there's a certain degree of trust and confidentiality that runs there. But for the most part, I'm bound by confidentiality when it comes to our systems. That being said, I think it's one thing to bring up student concerns on behalf of other people, because I really want to engage with what Amanda said here, Chair Liang said here. It's one thing to bring up concerns on behalf of other people, but it's another thing to have those people speak for themselves. And so for the most part, I think that this is a really good moment in which we actually got people to attend, people to contribute. And university administrators, at least on the lower levels, were made to listen. And I think that that's a really good step forward. For a variety of reasons, I can't really speak to all of them. They didn't happen as much last semester, but I think this is a really good way forward. So I'll stop wasting your time, but as always, if you want to talk more, just reach out to me privately and I'll try to talk to you, but as honestly and as bluntly as I can. Thanks.
Senator Liang, you have the floor.
I yield.
Okay. Just before we go to Senator Tulloch, you did ask or sort of had mentioned that I would have to recuse myself, and I would agree that if I were to speak at any kind of length on this, I would have to recuse myself. The only comment that I would add to the particular point is that at the most recent CURT student subcommittee, there was discussion of ways to better communicate many of the items that were discussed here to students and to gather student engagement. But that was a topic that was at the meeting. Senator Tulloch.
Yeah, I just want to emphasize that in those communications and when we're talking about forming new ways of communication, we really need to be, I guess, persistent on the point that more online interaction, I guess in terms of filling out the online forms and then getting the emails back and just reading instead of having those conversations up front is something that needs to be prioritized for students. And I definitely think, although the conversation was productive, a lot of answers did come back and they were cyclical, or they didn't really get to the point. And I think that's something we do need to be persistent in, whether we have a town hall, which is something I was talking to Amanda about, or some other type of community-based situation where students are actually able to ask questions, is that we're getting certain concerns to them before we actually have the meeting, so they don't have that excuse of, oh, I don't have this piece of information for you right now, so I can't give you that answer, or I don't know exactly who to get this information from, so let me draft a email or something and get it back to you, because I did see that as a big way for them to get out of certain questions during the meeting. So yeah, I yield.
Senator Cosme.
Yes, thank you. So I had a couple of questions. The first question was,
why can we not have, like, why can the public not have access to the conversations, with the exception of the very specific confidential issues discussed in CRIT meetings? Why can't we have access to those? And why is it not possible for student representatives beyond that of SA government to be there, like, at least for a very specific period of time? Because I feel like if this is the form of discourse that could take place at that point, before all these issues come to light, I think we could save a lot of time by making sure that all of these issues are solved before it becomes an issue so pertinent that SA government has to bring it up, and that too, senators have to bring it up with the like after the executive has seen all that happen. And the second question was, why does SA government not get paid? Because we deserve money for this shit.
Do you yield?
Senator Liang.
Yeah, I second Savit's first part. I have no opinion about whether or not we should get paid because I'm graduating and whatever. But look, I think another thing to be mentioned is the fact that, like, you know, we as student government sort of fall under this problem of like bureaucracy and bureaucracy and bureaucracy. I think what I wanted to ask in the follow-up to my question to leadership is, what are you personally doing to hold these administrators accountable? Because if it's the case that, you know, we're waiting until Senate, we're waiting until we made this swap to, you know, have those administrators come to our meeting for it to be productive, you know, why is it the case that that's happening? Like, what sort of issues are you guys encountering when you're meeting with administrators?
Do you yield to a particular person?
I could talk about this for ages, but first I wanted to talk about the CURT main group. So I can't remember if it was like me personally that reached out, but like we had email correspondence in like July, June about getting student representation on every single COVID committee we could. The CURT Student Advisory Subcommittee actually was created as a response to us wanting to be on that main CURT committee. And essentially the relationship that, as it would be explained to us, is that really specific undergraduate concerns, and I guess like student concerns in general, because there's more than just undergraduate representation on that student subcommittee, they would be presented to that group to revision. The reason, as it was explained to me, that CURT per se like is, you know, like this on this pedestal separate from, is that, well, for one, they're like meeting every other day, and for two, like a lot of the issues they touch upon are really like the medical center focus, not necessarily just like student life, specifically undergraduate. So again, how the student advisory board was created to try to like find a middle ground. And then on the point of making sure administrators are accountable for initiatives that we set out to do and continuing that communication, I feel like all of leadership can honestly speak to this, because I feel like we all have our own different strategies. But one thing that I've noticed a lot is, you know, other than like persistent emails and like anytime that okay, so like backtracking a little bit, a lot of us sit on different committees for the nature of our position. So using those also opportunities of those regular meetings to remind administrators of things and really kind of push the envelope when making sure that they're, to their best of their ability, are following through. I've noticed that a lot of the times with certain of the senior administrators I've been coordinating with, it's like, you know, between COVID and their regular responsibilities in a normal year, they're really strained for time. So it's really like difficult sometimes breaching that communication. So it takes a lot of just pestering, in all honesty. And I mentioned this earlier, but, you know, sometimes like initiatives that we do want to set forth and just like, you know, have a conversation about the administrator, sometimes they're not followed through, but a lot of the times also like changes happen because personally, I think I mentioned this in the leader chat as well the other week, is I feel like the best advocacy isn't necessarily, you know, done through tiresome like legislation and jumping through those bureaucratic hoops. I feel like I've accomplished more in my role personally by having those conversations with administrators. And as much as sometimes communication and accountability is hard, like people have been really receptive. And I think especially like lower admin, like the folks that we had on call earlier, like anytime I've had a concern and had to reach out to one of them, they either gave me explanation why it was completely impossible, or they tried to work with me to see what we can do. So, you know, that's a bunch. And I see Mark also has his hand raised. I know he's definitely had we've definitely ranted about this and had like, you know, discourse on how to be the most effective in our roles. So
so Senator Liang, you do have the floor, and you'd asked if you could rephrase the question.
Yeah, before you yield to Vice President Haddad, I would like to rephrase the question. Let's break this down into two shorter questions that end in yes or no. So as a result of realizing that we need public forums of accountability and not just meeting with admins, since as you mentioned, we've had a lot of difficulty with that in the past 2 semesters, in the past semester. My yes or no question is, would you be down to help to end the COVID? That's the first question. Second question is, can we write legislation such that it is we are able to do this structurally far more often? I yield.
I'm just going to say on the specific idea of restructuring Senate or open forum or town halls, that sort of thing. I would just recommend that we move that to a little bit later. In the interest of time, but also in that will be a subject that gets covered later in the meeting.
Yeah.
So it might be more pertinent in that portion of the meeting.
Yeah, and that's like Xander's wheelhouse. On the first question though, I don't know if it was just me, but the connection completely cut for me. So the question was like, I couldn't comprehend. Amanda, could you repeat that?
Just, are you down to do the town hall where we ask Dean Burns, AMA, and Dr. Manchester to come back again and answer the questions instead of just submitting the form to them?
I think if it's in the context of a Senate, I would defer to Xander. But like having an alternative session, I mean, there's plenty of possibilities, honestly, on how we can execute this. My personal wheelhouse is like the Presidential Advisory Committee, and like that particular group of student leaders, I've been trying to get administrators to like slowly like schedule meetings with them, because again, in-person advocacy, well, virtual advocacy, like direct communication, I think is the most effective. Going back to like the points made, after our town hall, how putting administrators on the spot, especially with a lot of students, the majority of students on call, is really helpful with getting the answers that we need. But yeah, to summarize, I think it's possible. I just, again, defer to Xander, since you're the one that, spearheaded this initiative for today.
So did Vice President Haddad want to add anything, or do you want to yield, Amanda, to Vice President Haddad for any additional context on the piece about, because I think we're sort of going in a few different directions with this conversation. So I want to kind of recenter on the main topic, as opposed to like reformatting or structuring or payment, like all the other kind of topics that we could potentially discuss at length in a different format. But specifically on your earlier points, if you wanted to add anything on that, like leadership and CURT calls and that sort of thing.
So the question is, can we do what we just did again, instead of submitting a Q&A to the administrators? Instead of is the key phrase there.
Yes. I mean, yes. For the purpose of just ending the conversation there, yes. We can talk more at length about what that looks like and logistics and context and all that at another time. But for the purpose of like an answer to your question, yes.
Okay, great, awesome. Another thing I just want to point out for the record is that they did not answer my second question, which was encased in like a personal anecdote of almost dying. But more importantly, the question is who is responsible, not which committee, what you can do, whose responsibility is it to make policy? And if it's all of them, who specifically creates policy? And that was a question that is still unanswered, that I don't think there is a satisfactory answer to because of the way our university is structured. But that's something that I think needs to be said for the record. I yield.
Okay, is there any other discussion for open forum? It can be on this topic or another topic, depending on what anyone has to say. It's an open time. And this is also as a conversation that can continue in future weeks. This is not the only time we'll have open forum. So in terms of discussion, the discussion can definitely continue at other times. So if there's no other discussion, we can move to the portion of the agenda that is discussion on updates from the previous week, projects, initiatives. As you'll note, this is perhaps a different structure than what it was previously in the last semester and the last several weeks. We're essentially going to not be having discussion during this meeting on any of the updates. If you'd like to see them, they're all down here below. And they will be like this. They will be in a more summarized fashion in future weeks. So with that being said, the only piece of concrete discussion that should be listed here is the change to the Senate meeting, which we just discussed. And I guess I'll yield to Parliamentarian Sahin if you, were you making a clarifying point or did you have something to discuss?
I just wanted to bring up something quickly. Can I do that now?
Sure. About what?
It was about like an update.
Sure.
Okay, so I just wanted to call people's attention to the elections updates, particularly the elections PPM and the spring 2021 campaign rules are being updated. And this was something where I'm both Fred as the elections coordinator and I are really requesting people's feedback because it will be taken into consideration. Yeah, that's pretty much it. I yield.
Okay. President Gorka, were you raising your hand from before or did you have something new to add?
No, you're good. I'm still trying to find the flow chart.
Okay. All right. And so essentially the new structure, as you can see, is that we'll have far less discussion on the general updates during the actual part of the meeting. Obviously, if there's significant pressing discussion like the elections and that sort of thing, we can still have that during this time. But the goal is to try to shorten the not as productive parts of the meeting to make the meeting more efficient. And so if there's no further comments on that, we can move into new business. Is there a motion? Senator Salimi.
Motion to approve bill to modify center classification with delayed implementation.
Is there a second on that motion? Senator Liang.
Seconded.
All right, we'll go into discussion. Would the bill writers like to explain anything about the bill?
I'll just briefly say that it's essentially the same thing as the bill to modify senator classifications, except based off of the Senate feedback, there's going to be a delayed implementation for the number of class reserved seats. It's not going to go from 3 to 2 this spring election, but it will for the following spring election. And yeah, that's pretty much it. Let me know if you have questions. I yield.
All right, is there any further discussion on this bill? Can you remind me, is this, Typhoon, is this a modification to the bylaws? So this would have to
Yes,
sit on the table?
I was just typing that into the chat. It would need to be tabled.
Okay. So if there's no further discussion, a senator could make a motion, or regardless, a senator could make a motion to table. Senator Liverpool.
Motion to table the bill to modify senator classifications with delayed implementation.
Is there a second on that motion? Senator Hathaway.
Second.
All right. Is there any discussion on tabling the bill? Seeing none, we will vote by unanimous consent. Is there any dissent on tabling this bill? Seeing and hearing none, the motion passes. It is tabled. Is there a motion? might I suggest 147? Senator Liverpool.
Motion to approve the minutes from February 8th, 2021.
Is there a second on that motion? Senator Salimi.
Seconded.
All right, is there any discussion on the minutes? Seeing and hearing none, we'll vote by unanimous consent. Is there any dissent on approving these minutes? Seeing and hearing none, motion passes. Is there a motion? Senator Salimi.
You can correct me if I'm wrong, but like motion to adjourn? Is that what the next motion is?
That is a valid motion.
Okay,
You are-
perfect.
You are always
Motion
welcome to motion to adjourn.
Okay, well, motion to adjourn.
Is there a second on that? Senator Liverpool. All right, is there any dissent? Seeing and hearing none, the motion passes. We are adjourned. Thank you all so much.
Bye, guys.